Hey guys, this is Jake here from Caulfield Family Chiropractic, and here at our practice, it is our mission to educate and empower as many people as we can so that you can live in a more optimum state of health and well-being. Now, if you've ever experienced pain that shoots down the back of the legs or from the lower back, down the buttocks, into the thighs, or you've simply just been diagnosed as having sciatica, then this video is for you. So what exactly is sciatica? Well, sciatica is any kind of irritation of the sciatic nerve. Now, what's the sciatic nerve? Well, if we come to my little chart here, it's this huge nerve that runs from the lower back all the way down the leg right into your toes. So it's this big nerve here. And if this nerve is irritated, this nerve can cause a lot of pain that shoots down the back of the legs. It might start as high up as the lower back, and it might run as low down as into your toes. And most people, if they have sciatica, they're going to feel that pain referring down into the back of their thigh. And sciatica is a kind of thing that can progressively worsen over time. So the symptoms over time may feel worse. Now, why does this happen? Why do people get sciatica in the first place? Well, as I said before, sciatica is any kind of irritation to that sciatic nerve, and that can come from multiple structures that can all affect that nerve. So that can come from stiff joints in the lumbar spine, it can come from the sacroiliac joints, or it can come from tight muscles around really anywhere that sciatic nerve travels. And basically, regardless of the specific structure, the injury itself is generally caused by some kind of trauma or stress. And over time, repetitive strain can lead to inflammation of some of those structures, and it's that injury that can cause that nerve to become aggravated, which will cause the symptoms to go down the back of your legs. So if you have sciatica, what could you do to help? Well, you might want to try these 3 tips. The first is, as I'm doing right now, you might want to try just walking around. It might be tempting, if you've got pain shooting down the back of your legs, to be a total couch potato and just sit and rest and relax so that the pain doesn't affect you. But it's actually a better idea to stay mobile. And the reason is that if you stay active and walking around, you're going to help move any joints and encourage the mobility of anything that might be aggravating those nerves, and that's overall going to encourage that healing response. It's quite often being sedentary and sitting down for long periods of time that cause the kind of irritation in the first place. So keeping walking and staying active is a good way to just make sure you're always moving the joints and any inflammation around and away from that area. The second thing that you might want to do is stretch out your hamstrings. Now, there are many different ways to do this. One of my favorite techniques is to use a door frame or a pillar of some kind. Now, I'm going to, as best as I can, come down on the floor here and show you guys my favorite hamstring stretch. All right, what we're going to do is we're going to use this door like so. And what I'm going to do is just with one leg, we're just going to run that up the wall like so with the other leg straight on the ground. And what you're going to be doing with this leg is you're going to be pushing it along that door frame or wall or whatever edge you might have found. And you're going to feel that stretch just coming along the back of the leg there. And what is that going to do? Well, by stretching out the hamstring, you're going to take a lot of stress off a really big muscle that overlies the sciatic nerve. So it's a good way of releasing pressure. And the third thing that might help is to stretch out some of the gluteal muscles or some of the buttock muscles around the same area. And to do that, we're going to do another type of stretch, which just involves being on the floor like so. And what we're going to do with our legs is one leg is going to bend up on top of the other so that your foot just rests where your knee is. And then what we're going to do is we're going to, with the hand that's free, we're going to reach around and grab the back of the leg like so that it's pulling on that area, and you're going to feel that stretch just coming up into that gluteal region there. Again, what that's going to do is it's going to take a lot of stress and a lot of pressure off the area that overlies where that sciatic nerve goes. And using those 3 tips, you should find that over time you have less pain, less discomfort. Now, how does chiropractic care help with sciatica? Well, it's my job as a chiropractor to help find the root cause of the symptoms, whether that's coming from the spine or the sacroiliac joint or any structures surrounding the sciatic nerve. It's then my job to correct them and then show you ways to avoid recreating that same problem in the future. So to correct them, we may mobilize or adjust a joint. We may advise a patient has some massage to address tight muscles, or I might show a patient some specific stretches, exercises, or lifestyle advice. The aim being to restore normal function, take pressure off the joints, off the nerves, and as a result, help a patient be healthier. Now, if you want these steps in a nice, well-written structure, please click the link in the video description below. You'll also see a special that we're running at the moment in the practice. So go ahead, click the link, and I'm sure you'll like what we've got in store for our next video. I'm sure that you'll see me around as well. Don't forget to like the page, as it is also the simplest way to stay up to date with these kind of videos. I'm going to be releasing some more information over the next few weeks. Like I said, click the link in the video description if you want to have a look at our offer or get these tips in a nice, easy to read list. And stay tuned until next time. See you around.